Hello everyone. In this lecture we are going to go over the AHIMA Query Toolkit. You do have access through your AHIMA membership to this toolkit in the body of knowledge within AHIMAs. You do have to log into AHIMA to access the body of knowledge, and you can do a search on toolkits, and this should probably pop up as the very first toolkit that you will see. When the toolkit opens, one of the options that you have is to open this toolkit in a Word document. And that is something that you'll want to do when you are actually preparing your queries for the query assignment. And so where is that? Okay, so let me get past the table of contents into the body. So I want to show you where that link is. And it's under instructions, the instructions for actually using the query templates, and you'll see that it says you may follow this link, and if you click on that link, this document will open in a Word document. And I'm going to go ahead and open the document and look at it in Word for the purposes of this particular lecture. When it opens, it will be, you'll need to click on View and then Edit Document so that you have access to edit the document. And then you do have an assignment on using the query tool that you'll want to complete. And so we're going to go down, well, let me scroll back up. We'll go over the introduction and the instructions, and then there are some examples. There is a generic template, and actually that may be one that you use particularly if you're not querying for a disease process that has clinical indicators. The way that this is organized is based on the chapters in ICD-10. So Chapter 1 in ICD-10, certain infectious and parasitic diseases, it does not correspond to chapters in your textbook now. These are chapters in the actual ICD-10 CM coding book. So that's how these are structured. And they have taken some of the common disease processes and created queries for those so that those can be used and not have to be regenerated. And if we scroll down, you'll see that there are quite a few of those. Coming down to the introduction for your assignment, you're going to want to be, if you're viewing this in a course that has an associated assignment, you're going to be going through the introduction. And it's important to know that querying has been around for many years. The purpose of querying is it's a communication tool, it's an education tool, and it does help clarify documentation, and it is supported by all of the participating organizations, and it is also supported by Coding Clinic, which is the official coding guidance outside of the official coding guidelines. Medical staff education is a very important part of this process. They need to understand why you're generating queries, so education may be a very big part of this. And then we have reasons to query. If you took HIM 216, in Chapter 2, we actually go over the query process. You may want to get your coding textbook out and go back and look over this in Chapter 2. But this lists some of the reasons that we may need to query to generate a query. And of course many times they're related to specificity with the disease process. Sometimes they're actually related to things like legibility or timeliness or consistency. And if you have conflicting information in a medical record, you may not have any clinical indicators, but you will have inconsistencies that need to be addressed. The actual query process, it can either be concurrent, and that means it's while the patient is still in the hospital, and it can be identified through clinical documentation improvement or maybe even through concurrent coding. Then the retrospective process is basically after discharge. These typically are queries that are generated by coders when they are coding the chart and they don't have complete documentation to work with. Queries can actually be written, or they can be emailed, they can actually be verbal. With the query templates, it says deletion of any part of the query form is not permitted, is not pertinent to, it says that you can delete any part of the query form that's not pertinent to your query, and you can add pertinent clinical findings that are documented in that health record. If you're conducting a verbal or a query over the phone, you would follow the same format as written queries. So there is the opportunity for verbal queries, telephone queries. And all queries have to be clear, concise, they cannot be leading, they need to be simple and direct, and they need to itemize the clinical indicators if you have them from the health record. I'm not going to read you the rest of these. You can certainly read these yourself. What I do, be sure you go over the instructions on generating queries. And if you're in a facility as a new coder, I would expect someone to be reviewing any query that you generated. As a matter of fact, in most organizations, there is a coding supervisor or someone that looks at every query that's generated before it's provided to the physician. Now, this is an example of the query template and how you complete the documentation for this form. And then this is actually the generic template. So in completing this, I might say, Dear Dr. Smith, and you can see that we can enter information here. It was documented within the, and then we can generate information here. So we could say, Dear Dr. Smith, and then you could enter here whatever documentation you found in that chart and where you found it, and that information would go here. So let's say, for instance, that a patient had a hematocrit of 22, and within the progress note in the orders, blood was ordered and the patient was transfused. Now, there may not be any clinical indicators for that. It may simply be that we have abnormal lab work. We can see that the patient was treated for that abnormal lab work. So in that instance, we would delete this information because it would not be relevant for our query. And then we have, based on the clinical indicators, based on the documentation, maybe we would take out clinical indicators and put based on the documentation in your professional judgment, and we might take out choose an item. We might just have please complete by selecting one of the options below. And in here we might put patient had anemia, or we may see what we may say here is, if the patient had anemia, please document the type of anemia. Then give them the option of other explanation, unable to determine, or no further clarification needed. So I wanted to be very clear that there are times when you will use a generic template, when there may not be clinical indicators, and when you may revise the documentation on a generic template or on any other template to meet your documentation needs. There is also a query for present on admission, and this is very important. There is a huge focus in healthcare on hospital-acquired conditions. They call them HACs, hospital-acquired infections, HAIs, and so many times queries are generated if there's any question about whether or not the patient has a condition that was present on admission. There's also a cause and effect relationship query. And this really comes into play when we have an infection and a disease process. The patient has a urinary tract infection. The urine culture is positive for E. coli. If the physician doesn't link the E. coli to the urinary tract infection, we can't code it. Same thing with pneumonia. If the patient has a diagnosis of pneumonia and their sputum culture grows out an organism, we need to have that organism linked. And so this query actually includes the information that you would use to link that. Then we begin with the queries that are very specific to the different chapters in ICD-10. I hope this brief discussion has helped you better understand the query guide. Please take the time to read this information and go through it. And certainly if you have any other questions, contact your instructor.